And now we want to talk to Dr. Gabriel Njue. He works with vulnerable communities in the densely populated areas of Nairobi. And Dr. Njue is on the line. Good morning, Dr. Ari.
Good morning, Brian.
This is Eric Latif. We have Nduoko, C.T. Muga, and Dr. Mercy Korir in the Situation Room. Asante sana for agreeing to speak to us.
Thank you. Welcome.
So, karibu sana daktari. First of all, we just start you off from the measures that the president announced yesterday. Working in the informal settlement, how have these measures been taken in? Are they positive? Are they negative? Do people see that these are measures that will answer their questions? How is the mood down there?
Yes. As of yesterday, the population was really eagerly waiting for what the government would be giving as the directions towards the containment of the spread of coronavirus. And the fear has been there that maybe there could be a total lockdown, but there is also the need in the community to contain this disease because of the fatalities of the condition that we are seeing. So the population is quite welcome on the measures. They were only fearing a total lockdown where they are not able to get out there and get the food for themselves. But now just having a curfew from 7 p.m. to 5 a.m. in the morning, that is quite manageable with a lot of the population.
Okay. Looking at the informal settlement and the kind of needs that the people are raising, first of all, water is hard to come by. I've had a situation where somebody is worried they don't even have that soap, let alone water. They don't have any of these things, or they are hard to come by. How are the people there maintaining hygiene? And two, the social distancing, knowing that these are densely populated areas. What are the practical things that people are putting in place in these areas?
Yes, we have a few quite serious challenges on the measures that the public health measures that we would want to implement in the community level, especially where Penda works, where there's a lot of population. Is that one is the social distancing. Maybe where you find the marketplaces are really congested, or even the living rooms are really congested. And the other is the social amenities. Maybe they have common water points, or they also have then the washrooms, and then the social distancing becomes a real problem. Some of the measures that they are putting in place is at the water point, then they have communal soap and ensure that each and every person who comes there, they wash their hands before they can fetch the water, or at some strategic entry points to the marketplaces, you are finding that they are placing some water and soap so that they can ensure that each and every person entering these shopping malls or these shopping areas at least have the standard hygienic practice of washing the hands and even using the sanitizer, alcohol-based.
So are they showing that they understand the dangers of contracting COVID-19 from your assessment?
From our assessment is that the society, even these populated areas, they are showing that they clearly understand. Like recently in one of the places where the neighbors actually called the MOH to tell them, hey, one of our neighbors here is really COVID. And that person was taken away. So for testing to Bagadi. So this is where really we are sensitized to the community, and we feel the community is picking up to know clearly that yes, we need to act.
And when you talk about the same people looking at, well, you cannot have social distancing with the circumstances under which they live, but then people still want to get out, go to work, go to eke out a living. What is their argument for why they cannot stay at home?
Yes, one of the main arguments why these people cannot stay at home, and this was also aired live on many of the media houses, that, they are worried of how they will be able to feed themselves. Majority of these people may be living on hand to mouth, so they go for jobs from Monday, maybe they are paid every day or by the end of the week. Or it is business, maybe they are just exchange type of vendors. So they pass to buy from the big markets in the morning, then sell so that they can have money of the day to feed the family and even pay rent and do all the other things that they need to do. So quarantining them to stay in their house the whole day, it's really a real challenge for them, and really can be understood.
Dr. Njue, we talk about it being a challenge, just from an eye perspective, but is it something that can happen? Looking at informal settlements, and they, consist the majority of the population, is it possible for this to happen? What is required now to stop the spread of COVID? Is it possible for this to happen?
It would be very challenging to contain people who do not have food in their houses. If you look at the global society where this has happened, is that people are locked in their residences and they are provided there with food. So it would be really a real challenge for the government to ensure that people are indoors and they don't have something to eat. So this is where the real challenge,
Now, looking at this, if you were to be asked, because as is the practice very often in this country, a committee would be formed, or, experts would be asked to come together and give advice on what should be done. If you were to be asked, having done a mapping, even if it's the mental one, of these informal settlements, what would be your advice in terms of what needs to be implemented for such to take place?
Yes, social distancing and hygiene, public health hygiene practices need to be implemented to curb this spread. This, the virus does not move. It is moved by human beings.
Right.
Mm-hmm.
And to stop the spread of this epidemic, really we need to adhere to what even the government and the global society are doing to limit the movement of the people. So the dynamics of how different communities can be, of how this strategy can be implemented in the different societies or different communities is what needs to be differential. Like if you take the up market, that's different, whereby they can even have their shopping and a lot of shopping in the house. But take it at Kibera or wherever else tender we are working, for example, in Kayole and all those other areas, then these people need to have enough social amenities like water, so that they can implement the public health hygiene. They have the water quite as adequate as possible. Then also food. If we have to quarantine people who do not have food, it is not going to be possible. Yes.
So is that it? It's not going to be possible? Or is it too early for us to say something like this?
I think, as the government said yesterday, that the measures which have already been taken, we need to see the fruit of them. But if they do not bear the fruit, then the government would be thinking of the most stringent measures. This may be a total quarantine. But maybe we see first how the response is from the Kenyans on the measures that have already been prescribed.
Talking about hygiene and people have to keep these measures, it's obviously difficult for some people. Who is providing this water and soap, for example, in those areas that you've talked about, like entry to market points or at the common watering points or the common washrooms? Who is providing this water and soap?
Yes, in some of these, you may find maybe it's a small shopping mall where they just sell CBOs, burgers, and etc. Some of the vendors have come together and decided to donate some money and purchase this. Provide a drum of water there with a tap where you open and the soap is actually there, because they have realized the importance of this. In common water points, maybe in a flat or thereabout, then you find maybe the residents of that area are putting up together because they are taking care of themselves and also of their own children. So they have communally put this together.
Doctor, is this sustainable? Looking at the pandemic, we don't know how long it will be here to stay. And then looking at some of the things that we have to pick out of this COVID pandemic, we probably want to have systems that will even last us post the pandemic. So is this really sustainable?
The best sustainable measures are administrative measures. In any outcome or any outbreak are the administrative measures where the government even comes in and provides such kind of utilities, like they test you, they provide transport for you, they provide these public health sanitization programs for you. So it might not be very sustainable in the long run if the epidemic, especially now that we do not know how long the epidemic is going to last. So it's a wait and see, but still the communities have the responsibility of doing the best to keep themselves safe.
Have there been any plans or any actions, now that you're cognizant of the fact that that is not sustainable, to engage government and other players so that some of these measures are there for the long haul? Are there any plans, any actions already that are in place for these people in informal settlements?
The Nairobi County government is very well involved because you mentioned a case, they are there and they are also teaching. So there are these forums whereby there is engagement of the various departments of the county, like the water department, so that continuous supply of water, for example, is there. But I believe the task force is going forward to drill down into this, especially the informal sector, to see how these populations may be more assisted to get better benefit of the government resources.
How about supplies of to the markets? Is it any, because now that we have restrictions, we have a curfew it's going to take effect from an all-night curfew or tomorrow. This is going to obviously affect, if you look at the hours of those curfews, it's going to affect people who operate in the market, in Marikiti, or people who are traveling, who are bringing in the goods from upcountry into the main market and then distributing to the estate markets. Is there any plan that you've heard of that's in place to ensure that there's proper and uninterrupted supply of food to the local markets?
Okay, these announcements were made yesterday by the president, maybe already after 5:30 or thereabouts.
Yep.
And so it is from today when plans are going to be underway, being put to ensure that most likely the transportation is also going to happen during the day. Then the purchase is going to be the following day, or transportation done in the morning, then purchases in the afternoon. But because the announcement was just done yesterday, I think today is going to be the real day of putting those plans in place, and we shall see how this unfolds. But for sure, this is a concern that people have to adjust to.
Dr. We are looking at that we've not seen any cases come from any of these low-income settlements, as it were. We've seen importation of cases of infections, and then from there the spread to other people. However, is this an indication of what the future could be, that it could be actually where we expect it to spread, it would not spread? All factors would point to that within the clustered areas, we would see that there would be a higher spread of the same. But so far, we haven't seen that. Could it be an indication of the future?
As I have said, is that this disease is spread by human. That's the person-to-person contact. And it is likely, using that analogy, to spread where the population is high. Mm-hmm. So, although what we have seen is whereby the cases have been imported, and now we are seeing community spread, because Kenya is now in the stage of community spread.
Yep.
The spread is going to be higher in densely populated areas than in the sparsely and upmarket, the living suburb of Nairobi. Mm-hmm. This is why the measures which were announced by the government yesterday are really key, even in those informal settlements. This is where they are going to be very key, because even though you have seen only those who have tested maybe have come and they have been in this upmarket or not in the informal sector,
yep.
They have people from the informal sector have also gone into those social amenity places where these other people have gone.
True.
Or these other people have also gone into these communities. There has been interaction of people. And if we do community-wide testing, I believe even some cases may be found from those informal sector communities.
Dr. Njue, when you run Pendo, you obviously come across many patients on a regular basis. And I can imagine that some of those people on a normal, ordinary day come to you presenting cases of respiratory disease. Are you seeing a spike in that? Are you seeing like a panic of people who start coughing or wheezing or sneezing and coming to you and telling you, I'd like you to test me?
Yes, thank you for that question, because we are seeing an increase in cases of upper respiratory infections. But we need to be cognizant that, this COVID disease is not so much distinguishable from the common flu that we are used to.
Mm-hmm.
Only that now, as healthcare workers or healthcare providers at Penda, we are at a higher level of alert that any person who comes with fever, they have a cough, they have difficulties in breathing, then we are like, hey, we are screening you for the temperature, for the questions, have you traveled, have you had contact with it? Yes, so we are seeing this, and at Penda we were really, like for the last 2 months, we were just preparing for this situation. So we are very well prepared.
And in the event of a spike in terms of people coming, like you said, the likelihood is that you'll have more cases coming from the densely populated areas. Those people will be presenting themselves to your facilities and asking for help. Are you well prepared to handle larger numbers?
We are very well prepared as Penda. As I have said, Penda for the last, starting January, when the group of picture was increasing, January and February, we were getting prepared for this situation or increased numbers of the disease, whereby we purchased huge consignment of the drugs that are used to treat upper respiratory tract infections. Like the WHO has confirmed that the best is paracetamol for fevers. We have a lot of antibiotics for the upper respiratory tract infections. All our facilities are well equipped to make the triage, to make a decision at the entry point. Are you having a respiratory tract infection? Do you have fever? And if so, you are taken into an isolation where the doctor comes in very well gloved and with the personal protective equipment to assess you. And if that doctor still finds that you are at risk, then we are quickly contacting the MOH so that this person can be taken away for testing and also maybe quarantined.
When, Dr. thank you very much for that information. It's very encouraging and uplifting. When you say you are prepared beyond having medication for upper respiratory diseases, what other measures have you taken into account in terms of your preparedness?
Our preparedness is that, number one is that we have increased the number of personnel.
Yes.
Because you know that some people will still fall sick, maybe they are sick from common disease or some other issues, and these are stuff. So we have ensured that we have about 10 to 20% of more than the number of the regular staff that we have.
Yes.
So that all our facilities are well manned. There's no human resource shortage. That is number one. Then number two, we also have a call center, whereby patients at home, they can actually call so that we can do telephone triage. And then we can do advice. If that one, you need to come to the hospital. Or that one, you don't need to come to hospital, you can do 1, 2, 3. Because there is also the need to decongest the healthcare facilities to keep space for these patients who are coming.
Right.
Then we also now, like me, as a medical doctor in charge of the clinical services, I am on standby 24/7, so that I can be at a position to run into any of these facilities and give the aid. And then the support center, they are also our support center, Penda Support Center, is also on high alert to make sure that any distress call is handled as required.
Among the cadres of employees that you have, do you have community health workers?
We don't have community health workers.
Yes.
It's like the people that we have at the medical centers are able to do health education to the people at the branches. But we also have been doing outreach previously. Right now we don't do outreach because, obviously this is congregating people together. But previously we have been doing community outreach.
Okay. Now in preparedness, when you say you've trained your personnel, what exactly have you trained them in?
We have trained all our personnel on the COVID-19, the case itself. This is the case definition, the history of the disease, the spread of the disease, the case definition, the symptoms, and the way the disease is supposed to be managed. For example, at the entry point of each of our facilities, the staff who is waiting there is well in a mask and has a thermometer and has very well revised and understands the case definition. So when you come in there, they will greet you and they will tell you there is this epidemic and we would like to ask you a few questions. So they will ask you whether you have fever, whether you have cough, whether you have any sore throat. Have you traveled? Have you been in contact with a person who has traveled outside or a confirmed case? And right now, we are also asking, are you possibly a healthcare worker or have you been to some hospital in the last few days? So they educate the public as that. Then they take your temperature because sometimes people have high temperatures and they do not.
Yep.
Yes.
Now, finally, Daktari, tell us about the cost. Who's paying for this service? Who do you expect to pay for the services when people come to you?
Just as before, we haven't changed the methods of payment of who is going to pay. Is that those who are paying cash, they will pay cash. Those who are on credit facilities, either from insurance or the corporates, they are still going to pay. But I would urge that the insurance is to continue to pay for those who are insured, even if they are found to be positive, or the government to take up the cost of those who are found to be positive for COVID and quarantine or other measures are concerned. But as for now, if you are paying cash, you are paying for yourself or the insurance is paying.
Can I ask the question, are you a not-for-profit organization? Are you an NGO? Are you a philanthropic? What are you?
Yes, thank you. PETA is not an NGO. It is a privately-owned organization, but it's an organization that runs on low margin and high volume model, whereby we just make small margin, but so that we can be at a position to treat and serve the base of the pyramid society.
Okay.
So we are not, yeah.
Sorry, I just wanted to find out from you if you've had any suspected cases that have met the case criteria, or anyone that has come through the facility that has later turned out positive.
We have had suspected cases, but when the MOH has come, they have maybe and just advised the quarantine, and none of them has actually turned positive that we know of up to now.
Okay. Right. Daktari, thank you very much for speaking to us.
Thank you so much and welcome.
And we wish you all the best at Penda.
Thank you.